I think that the big issues are encapsulated in a way in the ambitions for end-of-life care, which is a framework here, but probably the ones I would pick out particularly is how do we personalised care for the person so that we really focus on what matters to them, both in terms of their preferences but also in terms of their needs, and how we support the people who are close and important to them. And part of that is also making the system responsive to their needs and feel coordinated, because that is a really big issue for people. And then beyond that, for the individual, I think that we have a lot of thinking to do around inequalities and how do we make sure that end-of-life care works for all groups of people, wherever they are. Yeah, I guess the priorities right now is about apart from what I've already said, it's also about making sure that whatever the care setting the person is in, that it is their experience of care that we really focus on rather than just where they are, or where they wish to die and so on. So I think that's important. I think the other thing that perhaps is important and of particular relevance to this project too is about how we support people and their families and staff to be able to have those conversations, those important conversations at the right time, early enough so that planning can happen, but in a way that doesn't overburden somebody, so that it's seen as a process of conversations rather than, one big conversation. The PFCC programme ideally fits because it focuses on the person, on those who are close to them and their families, and on staff. And it is absolutely centred on the person. So in terms of where it supports, for example, the ambitions for palliative and end-of-life care, we have 6 ambitions. It fits really well into the ambition, which is about seeing the person as the individual, and also about staff being prepared to care. So there are a lot of projects going on for end-of-life care. Some of them are about trying to embed good practice into into core business. Some of them are testing out different ways of doing things and trying to improve things. So I think I would encourage teams to see the PFCC programme as one quality improvement methodology amongst a few others, but this is one that very much focuses on patients and their families, and to kind of not to try and do all quality improvement programs in the same place at the same time, but to pick and choose what suits them at the right time, really. So keeping the focus when there is so much going on is really difficult. I think the first thing is to keep the motivation by staying focused on why they're doing this, being really, really clear why they're doing this. Being able to articulate that for other people. I think what will help them is to think of this not as an additional thing to do, but it's a different way of doing things. And actually we've seen some evidence from the earlier PFCC work that actually there are other outcomes that are unexpected, other positive outcomes that they might want to think about. And I think ultimately it will help people to provide more effective, more satisfying care, and care that is hopefully more targeted at what matters to the person. And that will be better for not only the people they look after, but for themselves as well. So if they can stay focused on that, it will keep the motivation going. And the other thing is probably to be ruthlessly realistic about what they can achieve at any one time, and to see this as a process rather than as a one-off project. Okay, my hopes for the programme are that it will be seen not as a one-off project, but that it becomes embedded in the way people do things, and not just for end-of-life care, because I think if they get it right for end-of-life care, they will improve care for a lot of people. But this is a methodology that will work for other areas of care as well. So, end-of-life care can show the way for some of this as well. My advice would be to use the methodology that's been tried and tested. Try not to take shortcuts with it. Try to stay focused with it, and try to keep each other going, because there will be times in any project when it will feel hard, it will feel too hard, and hopefully not everybody will be at that same point at the same time. So keeping each other going is really important, and they are part of a project that has other teams involved, and so using that peer support, I think, is really helpful.